Hi, this is Brenda Messling-Schwarzbach, and this is a wonderful application that you can do for someone who's just sitting in a chair, anytime, anywhere. As with all creative healing treatments, it's best to do the general treatment first. And with headaches, if they have tight shoulders, work on their shoulders a little bit to get the circulation going before you do the next part. The key to the treatment for headaches is to loosen the attachments of the muscles at the cervical vertebrae. In order to do this, you need to get the cooperation of your client. If they hold themselves too tightly and do not let you move their head, it will not be very effective. Be gentle but confident, and you will have better luck. When working with a common headache, you will create space between each of the cervical vertebrae by moving the neck to one side and then holding your thumb or a finger on the attachment and then moving the head in such a way that the muscle or tendons have an opportunity to stretch or to return to their natural position. Many times the problem in common headache is in the middle of the neck, around C3 or C4, but any of the vertebrae may be displaced. Since I feel this treatment is so important and is used so often, I'm going to show you the movements in a couple of different angles to best illustrate what I'm doing. The text describes using your thumb as a way to do this movement, but for me it's much more comfortable to use my index finger, so I'm showing both ways. You will place the index finger or the thumb on the vertebrae that is displaced, then open the joint, and then rotate. You could do this in just one place if the person has just one vertebrae that is displaced to one side or the other, but I usually do both sides of the neck for each client, beginning with C7 and working my way up. For migraine, the topmost vertebra just underneath the skull is generally displaced to the right, but check both sides. The place for epilepsy is the lowest-most spot between C6 and C7. This is usually done with the thumb, and if you can feel the displacement, take your time. Remold the substance and wait for it to yield. As a massage therapist, many of my clients are lying on a table rather than being seated. In some ways, performing the movements for headaches is much easier with a client lying down. They are more relaxed, and I feel I have more control. Turn their head, slide the fingers between the vertebrae, and then bring the head back to center so that the chin is straight up. Never move their head past the center line. Next, I'm going to show you the movements for replacing substance along the jaw. You can do this for a client with face pain, Bell's palsy, or if they've had a stroke and one side of their face is affected. When working with the jaw, you will scrape underneath the mandible with the edge of your index finger, bringing the tissue into the notch, which is about 1/2 to 3/4 of an inch from the angle of the mandible. Do not drag your fingers through the notches from either direction, but feed the substance into it, which will encourage the nerve to be in the right place. The same is true for the nerve center at the tip of the chin. Work from either side. If you feel something that is not smooth, that's the problem area, and spend a little more time here. The lift itself is wonderful to receive. Be certain that you as a therapist are comfortable, because you will need to use very, very light movements with enough olive oil to relax and lift the skin to create the effect that you want. Clients love the way this feels, and they don't seem to mind that their face gets oily if they can see the results so quickly. Lift the tissues gently with one hand, and then catch it with the other to keep it in place. For most clients, I've found that 7 minutes on a side will produce noticeable results. See the text for more information about these particular treatments, and thanks again for joining me.